views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.
Good day. You are listening to Ability Radio. I'm one of your hosts, Amelia Headley Lamond of the Disability Rights Center of the Virgin Islands. And today we are very privileged to have a colleague in the struggle for civil rights, human rights. His name is Wilfred Labiosa. He's the CEO and executive director of an organization called Waves Ahead, a groundbreaking community-based organization in Puerto Rico. Good day, Wilfred Labiosa. How are you?
Buenos dias. Thank you for the invite. I'm doing well. I think everybody in the USVI and Puerto Rico are lucky enough that this last hurricane didn't hit us as hard as expected. So we're lucky. But there are more to come. So for now, I'm doing okay.
Good. Tell us about yourself, please. Give us a little introduction.
Sure. I'm Wilfred Labiosa, as you mentioned. I am born and raised here in Puerto Rico, but I went to Boston, Massachusetts for almost 37 years. I lived there, not only educating myself and gaining a degree in a PhD and a couple of master's degree from universities in Boston, but also I was always connected to the folks here in Puerto Rico and the LGBT community. So I always wanted to come back to Puerto Rico and do some of that work hands-on. So in 2014, I decided to leave everything behind in Boston that I had established myself. And I was working as the executive director of an organization working with Latinos in recovery from substance abuse and alcoholism and mental health issues to come to Puerto Rico to not only take care of my parents, which both of them as of now passed away, but also to work with the LGBT community. Upon landing in Puerto Rico and coming here, and I have to admit, for the last 37 years, I used to come 4, 5, 6 times to Puerto Rico.
Oh.
And many of those times, I always connected with USVI. I visited many times St. Thomas, many times St. John's, and many times in St. Croix. And it wasn't until I moved to Puerto Rico that I started to strengthen those relationships. I worked in St. Croix with the Women's Coalition, as well as with the Frederickstead Health Center and their program for people living with HIV and in people in recovery. And then in 2018, I started to work alongside with the Caribbean Museum Center for the Arts, so CMC Arts in Frederickstead. And in Puerto Rico, I saw that there was a gap on services for my community, myself. And you can think of it, well, he needs it for himself. Yes, I do. And what I wanted to create is an organization that provided all the different types of services that I need when I retire and when I may not have the people around me that could take care of me.
Right.
And so I developed Waves Ahead in the summer of 2017 to really provide mental health focused services and ancillary services such as yoga meditation, such as mindfulness group, any other tool that they could need in order to be somewhere could be self-independent, independent living as an older adult. So my Ways Ahead was established and focused on the LGBT older adult, in the LGBT community, and in the older adult general population. And then establishing Ways Ahead was hard because we were hit, USVI and Puerto Rico, with Irma and Maria hurricanes of the fall of 2017.
Right.
And so we had to stop doing that type of work of mental health and provide more hands-on on not only providing generators and food, but also mental health first aid, which is a type of intervention that we can provide short-term, hands-on, anywhere around Puerto Rico. And we developed a program called Reconstruye Q. Reconstruye Q brought together people from the diaspora, LGBT and Puerto Ricans and Latinos, to come to Puerto Rico to do this aid for the individuals here trying to survive after the Hurricane Maria and Irma. And as of now, we finished that program rebuilding 21 homes and providing over 8,000 individuals with food from so many municipalities around Puerto Rico, not only LGBT community, but also general population. And at that point, we were able to, and we still do, anytime that there's a crisis in Puerto Rico, we provide aid to anyone who needs it alongside as they respect the diversity that is providing the service.
Absolutely.
So in a nutshell, that's me. Meanwhile, for the last 26 years, I've been doing trips to Cuba.
Mm-hmm.
And that was because of my dissertation topic and also of my interest as a nation that is here in the Caribbean.
Right.
It's next to us, to
Right.
USVI and Puerto Rico, very close.
Right.
It's the largest island of the Caribbean, and there's so much to learn from them, and we can teach them and they can teach us. And so I started to be involved with the LGBT community there
Mm-hmm.
since late 1990s up to today.
Mm-hmm.
And that has transformed itself to me writing a dissertation. I have 2 doctorates. So one of my doctorates is based on the LGBT trauma that individuals that live in Cuba that did not leave have lived throughout the years,
Mm-hmm.
and how they express themselves into an LGBT Cuban revolution,
Mm-hmm.
that they have transformed the regulations and the constitution. And also I have met so many artists because my dad, the late Wilfred Labiosa, was an artist, have connected me to the art world there. And so now we do educational trips for CMC Arts
Mm-hmm.
to go to Cuba to learn about the artistry. And I think you participated
Yes.
with us.
Yes.
And so you have learned about the art, not only graphic art, but also photography, about music, and about culinary art. So everything is combined in these trips that we do annually to Cuba as part of CMC Arts programming.
Wow. That's a lot. I was also struck by, first of all, you started not that long ago, quite honestly, and you have 5 service locations on the island of Puerto Rico, which I think is very impressive. Where are those
Thank you.
locations? I mean, it's all around the island.
Well, they're in the 4 cardinal points of the
Mhm.
island. So, the municipalities, I can mention them, but,
Right.
people may not know where they're located, but they're in the 4 points of the island, plus in the capital in San Juan, which is where I'm connecting with you
Mm-hmm.
for this radio show. So we have San Juan, we have the northeast, the northwest, the southwest, and the southeast. And we saw that there was a need for it. Every time I open a center, everybody says, "You're crazy. There's no gay people there. There's no elder people there." Well, and I argue with them saying, well, elders are the majority in Puerto Rico.
Right.
Elders
Yes.
beyond the age of 55 are the biggest population here because the economy here is very different than the USVI.
Right.
We, although get snowbirds, like we all call them very lovely individuals, snowbirds, that's not the majority of the individuals here in Puerto Rico. In Puerto Rico, the young people are leaving the country.
Right.
And those snowbirds are coming here, and they're not snowbirds. They live here
Mhm.
because they get tax breaks
Right.
for their taxes. And that's a whole political show that we could do to educate people about that. I'm not going to go in the greater detail of that, but it is a problem because they're buying our homes. And so they are creating directly and indirectly a housing crisis here that individuals that are older adults cannot afford where they're living.
Right.
And or they are kicked out of their homes in order for the homes to be sold if they don't own it.
Wow.
And many individuals here are generational housing, which means that it has been their great-great-grandparents who left them.
Right.
And now they're the grandparent themselves. And so they don't have titles of ownership. So instead, these individuals are coming in, taking over those houses because they don't own the title. They
Right.
just own the house that is made of wood, maybe,
Right.
but is next to the ocean.
Yeah.
They buy it out from the government. And so we're having that crisis. So, so Ways Ahead has created these type of community centers so people can come and seek services. But also we're in the development of 3 housing programs that are so needed in Puerto Rico, focused on individuals that are elders. One of them has also a shelter that is focused on elders,
Okay.
no matter if they're gay or heterosexual or straight, but is the first shelter of its kind to be developed for elders in Puerto Rico.
Really?
And then also we have another housing program that is closer to the metro area of San Juan. The other 2 programs that I just mentioned are in the west coast of Puerto Rico. in the Northwest and in the Southwest.
Gotcha.
And then we're developing a very small program of housing here in the metro area that is focused on elders and the LGBT community that need a transitional place to go to their Section 8 voucher housing
Mhm.
or any other public housing. But yeah, we see that there's a need, and I continue giving statistics to them, but
Mhm.
we, for the longest time, did not have statistics. So WASA had developed this program in 2019 to start studying the
Mhm.
LGBT community, older adult.
Mhm.
And so until now, we have done 4 studies. Right now, we're finishing 2 studies, research about different topics that impact the LGBT older community.
Wow.
And that's how we can get data in order to use it to advocate for policy.
Right.
Now, that last piece that I just mentioned, advocacy for policy, because of this new government
Mhm.
who is very much friendly to the Republican Party in the States,
Mhm.
continental US.
Right.
We don't vote for Democrats or Republicans here in Puerto Rico. We don't
Mhm.
have presidential votes.
Mhm.
So it's just what their mouth says is that they're Republican.
Right.
We don't have a vote for president or for senator or for representative. We are like the USVI,
Right.
that we only have a resident commissioner
Mhm.
that can talk, and that's about it,
Right.
and can advocate, but that's about it.
Right. Right. One of the locations of your office is in Loíza, and I'm struck by
Yes.
that because, I remember over the years, friends of mine who are originally from, Puerto Rico would talk about Loíza and the concentration of African descendants there and the history there. And I remember that you took a group, including myself, to Loíza, which for me was very striking. What made you decide to pick that location as an outreach spot?
Well, Loíza, as you mentioned, is very diverse and is mainly based out of the Afro-Caribbean culture of, of Puerto Ricans. That's where, in the colonial times of the Spaniards, the slaves were housed
Mhm.
or were put there before they got emancipated.
Mm.
And so, for the longest time, it is where Puerto Ricans explore their Afro-Caribbean side or their,
Mhm.
heritage.
Mhm.
And at the same time, I noticed that although racism is across Puerto Rico,
Mhm.
there's also homophobia all across Puerto Rico.
Mhm.
But among the Afro Puerto Ricans,
Mhm.
all the isms also exist.
Yeah.
And so I wanted to address that issue.
Mhm.
So that center opened up mainly for education and also to provide mental health services,
Mm.
but mainly focus on education. We
Mm.
want to educate that community and all the surrounding neighborhoods or
Mhm.
municipalities about the diversity that exists even in the Afro Caribbean or Afro Boricua
Mhm.
culture.
Mhm.
And so that is mainly for educational purposes and also to be inserted in all the different aspects of the culture in Loíza.
Well,
And
exactly.
besides, the food there is amazing. So it's also great to eat when I go to visit that office. And all the staff is very happy that they have a center in Loíza so they can eat very well every day. That's besides the point, but they have excellent seafood and excellent cuisine.
And it's a beautiful location too. No,
It is,
yeah,
it is, just alongside the beach.
exactly.
I have to admit, mainly all of our municipalities are very close to the water, of
Okay.
course.
Okay. Well,
Yeah.
there's something very calming about being, watching or looking at the ocean. It does have
Yes.
that kind of settling, calming effect.
Yeah.
Which brings me to one of your reports having to do with anxiety. I read it and I was struck by how anyone can relate to anxieties, particularly as it relates to people who are, older. Your report talks about, how Waves Ahead is trying to assist persons who, are getting older. What are some of the stressors associated with aging? And admittedly, there are some things that I can relate to. Loss of loved ones, not being able to do the daily activities that you're used to. Losing your mobility, social isolation. No, I'm really trying to be very, conscious about that. Loss of independence, ageism, race discrimination, sexual orientation, or gender identity. But then your report talks about certain aspects, what anxiety means to them.
Mhm.
And I I think it's so universal, okay? One of the things you talked about was being worried all the time, feeling uncertain, feeling something bad might happen, difficulty sleeping or relaxing, restlessness, nervous, easily irritated. You know this phrase when, oh, you're a grumpy old man or a grumpy old woman? I'm like, oh, okay. Oh, yeah. And I know you have a background in psychology, no?
Yeah, I have a degree in clinical social work and another degree in psychology.
Okay, so you touched on some of the activities that Waves Ahead, focuses on to help older persons, and I'm going to say us, reduce anxiety. And what are some examples of that?
In Puerto Rico is a very interesting country
Mm-hmm.
because it can give an example to many other countries and islands
Mm-hmm.
around the Caribbean.
Mm-hmm.
Specifically, we lose a lot of our youth in Puerto Rico
Mm-hmm.
because they seek higher paying wages
Yeah.
for the most part
Yeah.
to the continental US or to Europe
Oh.
and now to Latin America.
Mm-hmm.
And so the anxiety of older adults losing that individual who most probably stopped once or twice per week to visit them, or even once a month, let's say,
Yeah.
they lose that connectivity.
Yeah.
And a lot of the older adults that we have seen and that we have interviewed for all of these research that we do, say we don't know about technology. So
Mm.
the young person thinks that they can connect with the older adult and it's the same thing.
Yeah.
But in our culture, that warm hug or
Yeah.
that warm kiss on the cheeks,
Yeah.
or just being there physically in front of you
Yeah.
is so well needed.
Yeah.
During COVID, we had an issue because many of our participants did not want to use technology. They didn't know how to.
Right.
Not that they didn't want to. And if they had technology, it was old technology that did not meet the current standards.
Right.
So for that matter, during COVID, we had to not only go to them to their, garages or to their patios and speak to them from afar,
Mm-hmm.
but we also had to provide technology. And we learned that even in itself provided anxiety to individuals and even desperation,
Mm-hmm.
because a lot of the vendors, including for appointments of doctors, you need to do them online now.
Yeah.
There's no phone, there's no someone on the other line, because doctors also that are here providing services have to cut from their budget. And so the first thing is to use an app that they can make an appointment with them. And older adults don't know how to do that.
Right.
Mind you, I'm generalizing because I'm generalizing on all of those individuals that live outside of the big cities in Puerto Rico.
Right.
And so Puerto Rico is small, but it's also very big in regards of the pots of population that are surrounding in the mountain range or in the countryside.
Mm-hmm.
And they don't have the same capacity to be able to connect like I'm doing with you today,
Right.
to record to do this show. And they don't have this bandwidth.
Mm-hmm.
And so that provides not only anxiety, but also frustration,
Right.
anger.
Right.
And so you start building up from that. And then the food stamps is not enough to buy food right now,
Mm-hmm.
because it doesn't give you the same amount of groceries that they used to give you to buy maybe 2 months ago or 3 months ago. The cost of living continues increasing, but the food stamp level is still the same. They don't increase it. And so, for the most part, and so that impacts your capacity to have energies to activate yourself during the day, to do maybe even on your walk, or maybe even to sleep well, because your belly sounds. And so we, in Ways Ahead, understand that there's so many issues impacting the older adult, and anxiety is one of them. And in these results, we saw the need to talk about depression and about suicide, because the country itself, the Department of Health here in Puerto Rico, reports that over 78% of all the deaths by suicide are on the older adult.
Wow.
I'm not going to say that in younger people, death by suicide does not exist. What I'm saying is the majority of the population here is older, and hence the majority of the death by suicide and attempts are on the older adult. And what are we providing to them? In that regards, nothing. Because the country receives, Puerto Rico receives all the money to do prevention for suicide prevention on younger adults because that's the line item of the federal government. And we have to take whatever money they give us, the leftover money, and it's focused on younger adults. You could argue with me, Amelia, that maybe that is because that's why we don't have that many deaths by suicide on young people. But doing posters and doing these billboards in the expressway, young people are not reading billboards.
No.
Young people are not reading newspaper little articles. They're not there. They're online.
Right.
So why don't you do a campaign and spend that money online?
Right.
Why don't you focus then on the young adults? Well, they don't either. And talking only about a specific religion does not help either. And because when you are in that sense, in that stage of your life, that you're attempting to die by suicide, you're not thinking, oh, let me grab a newspaper.
Right.
Let me do this. No, you're trying to really, you're in desperation. You're seeking assistance. And so the line that is here, the hotline for suicide hotline, although it works well and it receives a lot of calls and so forth, it is not as diverse. So when someone from the LGBT community or an older adult starts telling them about their issues, they listen to them. They may provide them some aid, but they don't provide them the referral that they may need.
Really?
Once again, I'm generalizing in many of the cases that we get. We're not a 24/7 entity. So we're closed by 5.
Right.
You know, we don't have a hotline and so forth. But we're here and we receive calls of people. And so when we get those calls, they tell us these stories. And that not only provides anxiety, anger, frustration, the individual doesn't know how to solve the issue.
Right.
And the older adults we're seeing that the older adults are entering this other new closet. And so this closet is for LGBT people, not necessarily. Is also for people who are Black, the people who are diverse of religion. They go into this closet in order to hide themselves until they get to that appointment, in order that they get that appointment. And it is an issue that is impacting the mental health of Puerto Rican here and also Puerto Ricans that are living outside. Because some of the older adults that have connections to the States are leaving Puerto Rico for a few months in order to get the medical care that they need and that they require.
Right.
Because they're not getting the specialist here in Puerto Rico.
Right. We can relate, quite honestly. You know, very similar issues that you're referring to applies here. And I'm also struck by the limits of mental health services. I mean, that's a serious.
Yeah, if you don't have a health insurance and private health insurance or a good health insurance, you don't get mental health. And if you do get it, it's 1 or 2 sessions. And you're an older adult, in 1 or 2 sessions, you're going to solve all your issues. If you're 70 or 80 in 2 sessions, really?
Yeah. No.
And they don't give you case management either. So at least give them the individual case management, you know, at least to help you maneuver the red tape that the government has implemented. And now with the new administration here in Puerto Rico and in the federal government, more red tape has occurred. And so the red tape is becoming so red and so much that, you know, is turning the frustration even more.
Right.
And then the government starts saying, oh, well, we haven't collected data on the hotline of suicide attempts, or because we have been so busy and we are understaffed selectively the last 3 months. What is going on there? You know, you are diverting the money to other areas in order to compensate those individuals that helped you get elected.
Right.
And that's something that is not only Puerto Rican and of Puerto Rico. That's most probably something that is going on in the USVI and many other states.
Right. No, understandable. What are some of the, we have just a few minutes left. What are some activities that are being planned for the future? I know you talked about housing. Was that one of them?
Yes. So we're hoping that in the process, we're going to refurnish these houses that were abandoned in the northwest part of the island, as well as in the southwest part of the island. We're building the shelter and building some transitional housing units. And in San Juan, we're also building some other, we took over a old school. And so abandoned school, and then we're going to remodel it to be apartments and also a community center and so forth. And then we continue providing services. But right now, for the last 2 months, we have been attacked by, the conservative agenda,
Mm-hmm.
to say the least. We have lost over $400,000
Uh-huh.
in contracts that were already given to us
Oh,
for
boy.
2 and 3 years, and we have lost them. We're right now awaiting that they reconsider them, and
Mhm.
we're in lawsuits about that.
Okay.
But we will continue providing mental health services. We will continue providing services from the centers. We are providing yoga and meditation, mindfulness. We are providing all the materials that you may need in order to grow your home garden, so you can have at least a salad, a healthy
Excellent.
salad every day.
Excellent.
And so we're trying to continue that, and also educating individuals about what are the issues that are impacting not only in Puerto Rico, but also we're educating people outside of Puerto Rico, so they know what is happening in Puerto Rico. So I really thank you for this opportunity, because that's how we can educate individuals outside of Puerto Rico about the issues that we're impacting that might be similar to the ones in your backyard. But
Absolutely.
that's good. Learn
Absolutely.
from us, and then try to implement something in your community.
Absolutely.
And restorative justice, people don't like to talk about that, but that's an intervention that is so simple that you can be doing in your neighborhoods. And also, if you don't know about restorative justice, listen, go
Mhm.
to your neighbor and
Mhm.
just talk to them. You don't even know maybe you don't know your neighbor.
Mhm.
Well, go to them and ask them how they're doing.
Right.
But listen, don't just say, how you doing, and just walk away. That doesn't work. It
Gotcha.
is to listen, actively listening,
I-
and really implement mindfulness. I know people look a lot of videos online. Look for mindfulness, look for restorative justice. These are interventions that you can do it. Mental health first aid, learn through a video. Don't waste your time looking at memes about politicians. Use instead those 2 or 3
Gotcha.
minutes to learn about these interventions that you yourself, without any degree, can learn and do it with your neighbor.
Thank you. Thank you. Thank you. I look forward to seeing you, and thank you for listening. Our audience, thank you for listening, and there's so much to learn. Take care and have a great day. Bye-bye.
The views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.